Hello, this is Dr. Ford Brewer with PrevMed, Heart Attack, Stroke, Disability Prevention. This is part 2 in a series on congestive heart failure. Congestive heart failure is one of those endpoints that we really want to prevent by getting this way early, back when it's atherosclerosis. Inflammation, maybe earlier than that with the atherosclerosis, or maybe earlier than that with managing risk factors. We talked about several things in the first video on heart failure. One is that 1 in 5 of us will get it. The other is that this is a devastating disease in terms of lifestyle and requirement for care. The other 4 will be touched. All of us are going to be touched by congestive heart failure. If it happens with a loved one, which is a high probability with those kind of statistics, you might be involved in caring for that loved one. Either way, you're going to be involved in helping pay for it. It is a major impact on healthcare resource utilization. We talked for a little bit about what causes heart failure, and it's the same thing that causes heart attack and stroke. Type 2 diabetes. Diabetes is a big cause. High blood pressure, which causes it because it adds further challenges to the burden on the pump function of the heart. We talked about what it is. Again, just a failure of the pump function from the heart. Mentioned another cause, heart attacks themselves, because heart attacks, myocardial infarctions, are places where you lose major sections of heart function, heart wall, heart muscle. We talked about how lethal it is. And one statistic said once you have a diagnosis of heart failure, your probability of being alive in 5 years is 50%. As you see in this article in Circulation, the average life expectancy, or the half of the folks, half of men were alive. Okay, 1 year, overall 1 year survival rates were 57%, and 25% in men for 5 years. In women, the 1 year was 64% and 38%. Those are far worse than the numbers that I quoted earlier. Now, how can that be, and how can both of them be right? Well, obviously, they're both not exactly right. I do think that the issue is when you diagnose early heart failure. Bottom line is, heart failure is a devastating disease. We're going to cover a couple more basics about heart failure. Some of the things that you learn to look for as a medical student. There are a couple of things you learn to look for. Number one is what we call jugular venous distension. As you see here, this patient he's lying down, yet the external jugular vein, you can see a lot of the veins in my neck, but you don't really see the external jugular vein like you do in this patient. And that's because that patient has heart failure. Why and how does that occur? Well, when you think about the pump function of the heart, there are no valves between a failing pump here and the external jugular vein up in here. So watching that patient, you can actually often see boom, 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 the waves associated with the pump function of the heart. That's medical student item number 1 with congestive heart failure. Medical school item number 2 is called pitting edema. This is a patient's feet, and someone has pressed down on the feet with 4 fingers. And as you see, that left pits because that patient's feet were so swollen. Again, it's that pump backup. Pitting just means that once you push down on the skin and you release, normally the skin will come back taut. But in skin that where there's backup of fluid, you'll see that pit remain. Item number 3 is frothing at the mouth. I'm not going to show a picture of that. I will share some personal story around it, though. My dad died after a heart attack, died with heart failure. He continued to have frothing at the mouth. That, again, is associated with this same backup of what we call hydrostatic or fluid pressure. And on a personal basis, again, this is a very emotional issue. For months, every time I started to run hard on a treadmill, that picture of my father, when I'm going in my high-intensity interval, I get this image in my mind, and I still do occasionally, but not every time. I get this image in my mind of my dad going, lying in a bed, and froth coming out of his mouth because of, again, the liquid backup. So as you can see, the patient experience, the family experience with congestive heart failure is just devastating. We mentioned a couple of times dementia, and that there was a connection between dementia and heart failure. Well, here, that's a picture, but let's look at some of the academic articles around it. This article is all about heart failure and Alzheimer's disease. In this article, they're basically saying it's unclear, and there's still debate. Obviously, there are a lot of the same causes for both dementia and heart failure. For example, diabetes mellitus, or diabetes, type 2 diabetes, very common, causes both of these items. In fact, as I've mentioned before, Alzheimer's is, by some people, called type 3 diabetes. ApoE is one of the things mentioned here. People with ApoE4 genotype have risk for Alzheimer's as well as heart failure. Heart failure itself is a risk for Alzheimer's. Now, on a practical basis, almost half of people that have been hospitalized for heart failure have cognitive decline. That makes caring for these individuals very, very challenging. That's just one of the other issues regarding how to care for these patients, one of the challenges around patient experience. Now, although this study says that there's some quandary about what the causes are, I have to go back and say some of my own theory here. You remember we've talked multiple times about heart attack and stroke. We've talked about inflammation. We've talked about this is a cross section of an artery. This was an area that had inflammation. It leaked through a narrow or a thin intimal lining with cracks in the intima, and this black thing is the clot. It's not inflamed plaque. Inflamed plaque, when it touches blood, causes blood to form a clot. And the larger part, this was a large one, and that large one, the larger part of this clot broke off, went downstream, and caused a heart attack and killed the patient. But these are not localized issues. This is a biochemical issue. If it's happening in one area of the arterial tree, it's happening everywhere. You see that on multiple videos that we've done. This brown section right here is a small section where inflammation of plaque is occurring. And again, you can look it up on several of my videos. You can look it up in Mayo Clinic, Harvard, you name it. Now let's look at that process from a different perspective, a thing I would call death by 1,000 cuts. So here's a normal artery, or a clean artery. Here's an artery where plaque has been laid down. Here's an artery where there's been some clot formation. This is not a great part of this slide here, but bottom line is you can get a major spill and a major large clot, but you can also get microscopic, and that's where the death by 1,000 cuts comes in. A huge number of infarct type of events happens, especially if you've got a patient with this process going on. huge number of these happen and you never notice it. You wipe out a few, you get a microscopic clot, you wipe out a few hundred cells in your heart or your brain, you're not going to notice it in either one. When you begin to notice it is after this happens 24 hours a day for decades. Then you get massive loss of heart tissue as well as brain tissue. Again, we're getting on into the time here. I will do a part 3 to talk a little bit more about what's being done to help patients with congestive heart failure.